Welcome back to another episode of TimeOut with the Sports Doctor podcast, where life, sports, and medicine intersects. We are glad that you are part of this growing community where we strive to help you strengthen your mindset, help you grow your assets, and help you achieve whatever level of success that you want for your life. Go to our website at Dr.Derrick, thesportsdoctor.com, where you can find all the latest content, and you can also follow us on our social media channels. Now, let's get into this episode. So welcome back to another episode of Time Out with the Sports Doctor, and we have another great guest for you today and a very important topic that I'm eager to present to you just from an educational standpoint. I know you will learn a lot because I've learned a lot from our previous discussions, but I'm very glad to have Dr. Lametra Scott here with us today. She's a pharmacist by trade, and she is a spokesperson. She's the founder of Breaking the Sickle Cell Cycle Foundation, where she does a lot of education work about sickle cell, about knowing your status. So very excited to have you on, Dr. Scott, and I'm glad to be able to highlight the work that you're doing and really shed some light on sickle cell disease and sickle cell trait.
Well, I appreciate the opportunity, Dr. Burgess, to be here and to share about something that's near and dear to my heart. And unfortunately, so many people are or could possibly be impacted by sickle cell trait, sickle cell disease. And for those who have trait, they may not even know it. So I'm glad to be here today to kind of shine a light on something that is very common in the minority population, but also just, to make people want to be more aware and get intrigued to find out what's in their genes as well.
Sure. And one thing I like to highlight is that one of the major reasons why we're talking now is because National Sickle Cell Day is coming up, June 19th, 2024. June 19th is the day where we really focus on sickle cell disease. So I wanted to do my part in educating my podcast family as well as the masses about sickle cell, because I know that even as a physician who I deal with athletes that have sickle cell trait, my knowledge was limited. So I've learned a lot just from talking to you already.
It's something that is common, and by the time you really realize how important sickle cell trait or sickle cell disease is, it's usually too late. And when I say it's too late, it's typically because you have experienced some type of complication, whether it be from sickle cell trait and exertional sickling, or if you have a child who has sickle cell disease and you found out by way of you and your partner both having sickle cell trait. So I appreciate the light that is being shown here and the torch that you're picking up to carry to educate the masses in your audience too about this.
Sure. So let's start off first, just from an educational standpoint. A lot of people might have heard about sickle cell disease or trait, but not really understand the difference. So let's start off talking about hemoglobin, which is very important with helping transport oxygen throughout our body. So what's different about a sickle hemoglobin cell versus a regular hemoglobin?
Well, in the sickle hemoglobin, so let's back it up just a little bit because we're talking about a disease of the red blood cell. So that's very important to know. So in those red blood cells, as you stated, hemoglobin, it is responsible for carrying oxygen around. Well, in sickle cell disease, instead of having a normal gene that produces regular hemoglobin termed hemoglobin A person may inherit what's called a hemoglobin S gene. And when they inherit two copies of that hemoglobin S gene, meaning one from their mother, one from their father, that person has what's called sickle cell disease. So when the hemoglobin S begins to deoxygenate, or in conditions where there are decreases in oxygen or conditions where there is dehydration, then that hemoglobin S, instead of having the red blood cell have that round donut shape, that hemoglobin S actually causes the red blood cell to change formation, and it begins to take on the shape of a sickle. That's where the terminology sickle cell disease comes from.
So when you have the sickle cell or the actual abnormal trait, it affects your ability to really do athletic activity or to really do just kind of day-to-day tasks many times. So let's start off with knowing your status, or why is it so important? Because we think about sickle cell many times in the US talking about athletes, because we know the exposure and exertion that it takes to be an athlete, especially playing football or track or things that you're outdoors in the extreme heat. But why is it
Mhm.
important for everyone to really know their status?
It's important for everybody to know their status first and foremost as it relates to family planning. Because to be honest, that's the way that sickle cell disease comes about. When a mother and father both carry the trait for sickle cell disease, and keep in mind, we're talking about hemoglobin S type, but there are 5 different types of trait that you could have. So if a parent carries any of those traits, when both parents are trait carriers, there's a 25% chance that if they had a child together, that child could have sickle cell disease. There's a 50% chance that the child could have sickle cell trait, and then there's a 25% chance that the child could be absolutely normal. The problem comes into play is that most people may not know what their sickle cell trait status is. They may not know if they carry that hemoglobin S gene because, one, they may not have been tested, and their parents may not remember what the results were if they were tested. So it's so important, especially for people that are of childbearing age, to know their sickle cell trait status as it relates to family planning, so that you know what questions to ask of a potential mate, because all babies aren't planned. Sometimes things just happen. Well, if that's a situation that you find yourself in, you would definitely want to know what's the status of your potential partner that could be a parent. In addition to family planning, as you alluded to, athletes need to know their sickle cell trait status for that very reason that you stated. It does require a lot of intense aerobic activity to do the activities that a lot of athletes partake in, whether it be football, basketball, track, you name it, anything that requires you to use a large amount of oxygen, because keep in mind, the red blood cell's main purpose is to carry oxygen throughout the body. And if you have a hemoglobin S gene, that means your body may not be carrying oxygen as well. So you need to know those particular things that you need to watch out for. If you are a sickle trait carrier and you participate in sports, you need to know the signs and symptoms of what to look out for, when to take a break, when to rehydrate, when not to push it. That is why it's so important to know those things early on, because if you are ahead of the game, you can prevent some of the severe complications that can take place after the fact. And then the last thing is to know about your own physical health. People who are sickle cell trait carriers, they are oftentimes at risk for having kidney issues. And sometimes those things are dismissed and they may be labeled as something else, maybe a urinary tract infection, or maybe, my back is just hurting because I did a little bit too much extra with my weightlifting. But sometimes those things could be indicative of something else is going on, and it may be present because you have sickle cell trait.
Sure. So let's talk about, I know in the United States, all babies are screened at birth, correct?
Mhm. Yes, they are
Um,
now. Yes.
yes. And when did that start?
Well, I can't say when, because each state has a different time period in which they decided to take on adding sickle cell trait screening to the newborn screen. So the last state, I want to say it may have been added in 2012. So I want to say early 90s up until 2012, each state would come on in terms of when they added sickle cell trait screening to the newborn screening panel. But as of today, yes, all 50 states are included, or they do have sickle cell trait and sickle cell disease, for that matter, screening included once a baby is born.
Sure. So I think it's fair to still say there are a lot of people who do not know their status that were
Mhm.
born. If you're not a millennial, you still probably
Right.
don't know your status just from birth. So we really have to educate people on the importance of knowing your status, especially if you're still in the reproductive ages.
The downside is, even if you were born after the 90s and your parents got the information, because most people with sickle cell trait typically don't have any symptoms, they don't have the vaso-occlusive episodes like a person with sickle cell disease traditionally would have, they may not know. So in that case, the parents may not even remember whether or not the person had trait 15, 16 years down the line, because their baby really didn't have any problems throughout early childhood and adolescence.
Yeah. Let's talk about some of the early signs or symptoms that a parent or a child or, just a person in general might start to experience that will say, hey, I need to get tested.
For a person who has sickle cell traits And sometimes they may experience muscle cramps. They may experience fatigue. And all of this is in the setting of if you have participated in some type of strenuous physical activity, and all of a sudden you begin to feel this extreme fatigue, rapid heart rate, rapid respirations, and your muscles become extremely weak all of a sudden. Those are signs and symptoms that maybe something a little bit different is going on than what you regularly feel from just general fatigue. For the most part, it's stuff that happens rather suddenly.
So some of the numbers that I've seen associated with, especially sickle cell trait, are really
Mhm.
astronomical of how common it is, especially in African Americans.
Right.
But it is not only a disease about African Americans. I think that's probably a myth that a lot of
Mhm.
people think, but just kind of speak to that.
It really is a myth. So, about 3 million people in the United States carry the trait that causes sickle cell disease. So, when you look at the number of African Americans that make up our population, they can't all be, African Americans who have sickle cell trait. Well, that comes into play because of how sickle cell trait came to be. Sickle cell trait was actually looked at as a protective mechanism against malaria. So if you look at the areas in which malaria was endemic, of course you have the sub-Saharan African region, but you also have the Mediterranean areas, which is inclusive of Turkey, Italy, and Greece. You also have the Central Americas, you have the Middle East, and you also have Southeast Asia. So there is where we have this mixed bag, basically, of people who could have sickle cell trait and may not even know it. One, because of that very reason that you just stated, that a lot of people think that, oh, that's just something that impacts African Americans. And because of its protective mechanism against malaria, that's not true. And on top of that, we're a big melting pot now. Everybody, is with everybody. You love who you love. And
Right.
sometimes that may mean somebody that's not from the same ethnic background as you. Because of that very reason alone, you have people who are non-African Americans who have sickle cell trait. African Americans are disproportionately impacted, meaning that they are the greatest group. The second largest group that's impacted by sickle cell disease is actually Hispanics. And then you have everybody else, from areas that are what I just stated before in terms of the Mediterranean, Southeast Asia, Central Americas, and things of that nature.
I know you corrected me on a myth that I had that I was very incorrect about malaria. Like you said, it's protective. That's why the sickle cell gene is protective against malaria. But tell us about if you have sickle cell disease and get malaria.
Well, people who have sickle cell disease, one is enough and too much of a good thing is not a good thing anymore. So people who have two copies of that hemoglobin S, which actually can cause sickle cell disease, those people do not have that protective mechanism against malaria. And unfortunately, they succumb and actually can pass away. So there is a huge stark difference between having sickle cell disease and having sickle cell trait.
Yeah. So thank you for clarifying that for me as well. So let's
Uh-huh.
talk a little bit about treatment of sickle
Mhm.
cell. So someone that has, like you mentioned, if you have sickle cell trait, you might not even have any symptoms. So it's really important to
Mhm.
know your status before you pass it along to your offspring. But for people that
Mhm.
have sickle cell disease who might not
Mhm.
have access to the care that they need, speak to that a little bit and some of the resources that are out there for them.
Well, for sickle cell disease, the mainstay of therapy right now is hydroxyurea. Hydroxyurea is the mainstay of therapy because hydroxyurea actually causes your body to create or to turn on this switch that makes hemoglobin F. We talked about hemoglobin early on. Hemoglobin A, meaning adult hemoglobin, it does not sickle, but hemoglobin F, which is the hemoglobin that's made during that fetal period, it also does not sickle because it has different subunits than the hemoglobin S does. So your body actually turns off that signaling. I want to say between 6 to 8 weeks after the child is born, it turns off the signal to make hemoglobin F and it turns on the signal to make hemoglobin A. In sickle cell disease, that signal for hemoglobin A is actually hemoglobin S. But if a person were to take hydroxyurea, it actually causes the body to turn that signaling back on to start producing hemoglobin F again. Hydroxyurea is one of the mainstays of therapy because it can reduce sickling. And in addition, it has been shown to also reduce what's called ACS, or acute chest syndrome. It's one of the severe complications that can result, and that's when you have sickling of the red blood cells in the lungs that causes difficulty in breathing. And hydroxyurea can actually help to decrease the risk of contracting acute chest syndrome. It also has been shown to reduce stroke risk. People who have sickle cell disease, they have an increased risk of having a stroke, and that stroke can happen very, very early in life, from the ages 2 on up. A person with sickle cell disease is at risk for having a stroke. But if you were to take hydroxyurea, it actually reduces that stroke risk. So there are a number of benefits associated with taking hydroxyurea. And like I said, it is the mainstay of therapy. Additionally, we have what's called Oxbryta that has come out. And I guess I have to put this into context. Hydroxyurea was FDA approved for sickle cell disease in the early 90s. And just recently, it gained approval in the pediatric population. When I say recently, I want to say maybe between 2010 and 2012. But it was used off-label for the treatment of kids because they saw the benefit that the adults received. That same benefit was conferred onto children. So to put this all into context, sickle cell disease was discovered back in 1910. So from 1910 up until the early 1990s, there really wasn't an FDA-approved medication to treat sickle cell disease. That is a disparity in and of itself. What was available for the treatment of sickle cell disease in that almost 100-year time span were narcotics and blood transfusions. That was pretty much it. And unfortunately, because of the demographic of people that is commonly associated with sickle cell disease, that has led to a lot of the disparities in research and why there have not been a number of agents available for the treatment. So in 2017, research gods blessed the sickle cell community, and we had the first medication approved, which was Endarin. It's L-glutamine. L-glutamine works by stabilizing that red blood cell and causing it not to break apart so easily as the red blood cells do. In sickle cell disease, they are very fragile. And then we have Oxbryta, also causes the body to create more hemoglobin F, as we were stating before, the benefit of having hemoglobin F. And then you have a medication that's called Adakveo. Adakveo is an IV infusion that also helps to reduce pain episodes or vaso-occlusive episodes from occurring in a person who has sickle cell disease. So that is the context of the available treatment options for sickle cell disease. The list is not very exhaustive, but where we are today, research is ramping up in that space for sickle cell disease. So hopefully we will get more treatment options available. Just here recently in December, we actually received FDA approval for gene therapy, which is looked at as a curative option for sickle cell disease. Prior to gene therapy, there was a bone marrow transplant that was available for sickle cell disease cure. The downside of the bone marrow transplant is that you have to actually have a matched donor sibling in order to be able to even go through the bone marrow transplant process. Most people that are of African American descent usually don't have a matched donor sibling, or they don't have someone who could donate for them. So that kind of limited the playing field in terms of who can be cured from sickle cell disease. Well, with gene therapy coming along, you no longer need to have a matched donor. You can actually take your own cells and they can be modified, as we talked about, turning that signaling back on to make the hemoglobin F again. The person who has sickle cell disease, their cells can go through the gene therapy process and they can be modified. And then once they're modified, they can be infused back into the person. And if all goes well, then that person would be cured from sickle cell disease. So that sounds really great. And I did a really simple job of explaining how gene therapy works. The downside is tied into money. So right now, gene therapy costs between $2 to $3 million. And I know that there's some work going on with the manufacturers and with the government in terms of trying to come to an even playing field in terms of how do we make these curative options more accessible to the group in which they were intended to be utilized for.
Wow. I mean, $2 to $3 million. I can imagine what the insurance companies say when they see that bill.
Exactly. Yeah. So a lot of insurance companies are still trying to navigate that space to determine how coverage will be determined. Typically, curative treatment options are reserved for people who have very severe sickle cell disease, meaning that they have had some type of complication from sickle cell, whether it be they've had a stroke, whether they have developed avascular necrosis, whether they have pain episodes and vasal occlusion that has caused organ damage. Those are typically the people that would readily be considered for gene therapy. And then you have those who just, they want to be cured from sickle cell disease. So there's a wide range, but there are a number of risk versus benefit. And to determine whether or not gene therapy or either bone marrow transplant for that matter, to determine if that is the right path for you, it really is patient specific. It really is dependent upon what's going on in the background for this person before we decide if we want to take these risks. And when we talk about risk, the risk does include death. So even when trying to pursue the cure for sickle cell disease, death is a real risk factor.
As healthcare providers, we spend a large portion of our lives focused on our training as well as taking care of other individuals. But I'm calling a timeout because life can change in an instant. We know it's difficult to fathom that a sudden illness, injury, or death could put you and your family in a devastating financial situation. But that's where Dr. Stephanie Pearson and her unique team of advisors at Pearson Ravitz come into play. They focus on empowering physicians like yourself to protect your most valuable asset, your income, and life's most important people, your family. So go to PearsonRavitz.com to make sure that you are protected today. So we, for 100 years almost in this country, we treated symptoms without having a cure, which is mind-blowing just to think about that and to say it out loud. It's good now that we do have options, and you did an excellent job. You definitely put that PharmD into use with breaking down these treatments because they're very complex and sounds like they're growing by the number each year. So there is a lot of hope. I mean, for any practitioners or for anyone that had a family member of someone with sickle cell disease, you've seen the pain, you've seen the struggle, you've seen the hospitalizations, and you understand really the suffering that someone with sickle cell disease goes through many times during a shortened lifetime. Some of the things that I remember most being in orthopedics is how early the joints deteriorate and how early we do some joint replacements on teenagers, where that's unheard of really in for any other disease processes, where arthritis, we're doing it on 60, 70, 80-year-olds. And people with sickle cell disease, we're replacing multiple joints from knees, shoulders, hips in their early, late teens and early 20s, which is just terrible because you have to do something because the joints are really affected by that lack of blood supply. And the pain, like you mentioned, pain medication. I remember some patients that were on very high dose narcotic pain medications as teenagers simply to cope, because now that you're saying that, it wasn't a lot of other options. It was just treat the pain and treat whatever side effects have happened from the disease process.
Right. And that's because sickle cell disease itself is so complicated. And it's almost like sickle cell disease itself creates more of the problem. So we know the problem comes about because we have red blood cells that stick together, they block blood flow, and wherever you don't have blood flowing, the tissue is dying beyond that point. We got that part. In addition to that, sickle cells themselves are very, very fragile. A red blood cell normally can last you about 3 months. In sickle cell disease, a red blood cell can only last about 12 to 14 days. So the body is constantly trying to make more cells because red blood cells are necessary to sustain life. Well, in sickle cell disease, those cells break apart very quickly. And when they break apart, they actually cause inflammation, when you trigger the inflammatory system, all of the helper cells are going to come to this inflammatory process that's going on trying to fix it, where you've got these sticky sickle cells that are now sticking to each other, sticking to the helper cells, and now we've formed that blockage again. So we've got this intrinsic inflammation that's coming about because the red blood cells are breaking down, and we've also got the red blood cell in and of itself blocking blood flow, which is also causing tissues and things to break down. So trying to figure out how to fix the problems of sickle cell disease, it's very complicated, because once you fix one end, you still got another end that's going awry, and you've got to figure out how do you fix that side too, and do them both at the same time. So it's very complicated. And what we know is that narcotics block pain. We know that much. There wasn't a lot of research trying to figure out the complex processes going on prior to that 100-year time span of what was going on, trying to figure out what's the real pathophysiology that's causing the complications that result from sickle cell disease.
Sure. So this is a very specific question, but can you speak to sickle cell disease and surgery or anesthesia? I know specifically nitrous oxide is a question that was posed to me.
I want to say for a surgery, most patients with sickle cell disease will have to get a blood transfusion prior to, because they're already anemic to begin with. And anytime you have surgery, there will be blood loss. So a person would normally have to get a pre-op transfusion to get them prepared for surgery. As it relates to nitrous oxide, though, that actually is a benefit in sickle cell disease because it does cause vasodilation. And anytime you have vasodilation, even if the cells were to stick together, because the blood vessel is now dilated, it actually allows that blockage to actually flow through a little bit more freely than it could if it didn't have the nitrous oxide on board.
Great explanation. My wife's a pediatric dentist, so that was her question. All right. So, at first, when I first met you, I was like, okay, wow, we have a pharmacist who's really carrying this torch. But now talking to you, it really merges the two things together so well. But talk to us about why you, as a pharmacist, really are so passionate about sickle cell disease and why you created this foundation to help fight sickle cell disease.
To make a long story short, we talked about there being about 3 million people in the United States who carry sickle cell trait, and a lot of those people don't know it. When it comes down to African Americans, 1 in 13 African Americans carry the trait for sickle cell disease. Most people don't know it. I was one of those, or still am one of those 1 in 13 African Americans who have the trait for sickle cell disease. The same thing with my husband. He also has sickle cell trait. We had no idea that he was a sickle cell trait carrier. And we have a little boy, he's 11, he has sickle cell disease. So and I found this out later in life, and I tell people all the time, it doesn't matter how many letters you have before or after your name, education level does not necessarily equate to you automatically knowing whether or not you carry the trait for sickle cell disease. If you have not been tested for it, then you cannot definitively say, well, I don't have sickle cell trait, because a lot of times we don't know. And unfortunately, in the African-American community, we don't really talk about things of that nature, because for a long time, sickle cell disease was something that was shunned. People really didn't want other people to know that they had it, because there was a lot of discrimination associated with a person having sickle cell disease as it relates to employment, as it relates to social engagements, social relationships. So it was just very complicated, and people didn't want other people to know. So because we don't really talk about things, we don't know what's in our genetic history, what's in our ancestry. We normally find out after the fact. So because I found out after the fact that I was a sickle cell trait carrier, and in addition to that, my son was actually misdiagnosed. We got the wrong information on the front end regarding his sickle cell status. We were told he only had sickle cell trait. That's not true. My son has sickle cell disease type SS. We talked about those 2 hemoglobin S genes being inherited. He has SS, which is one of the most common forms of sickle cell disease. So there was another light bulb that went off to me. We have a huge educational deficit in the healthcare community about what sickle cell disease is versus sickle cell trait, in addition to the community at large not knowing and being aware of what sickle cell disease is. So I tell people this all the time. I did not start out to start a nonprofit organization. That was not on my list of things to do. But because of who I am, and after I found out what was going on and I saw how grim and doom and gloom the projection was for people who have sickle cell disease, I really didn't want my child growing up with that dark cloud over his head and with the limitations associated with sickle cell disease about what you can and cannot do. I wanted him to be empowered. I wanted him to be educated. That is why I started Breaking the Sickle Cell Cycle Foundation, because I wanted to be able to offer something to our community at large. Because if I didn't know my trait status, just imagine all the other people out there in the world who may not be aware of what their sickle cell trait status is either. And on the flip side of that coin, as a pharmacist, what I do was disease state management and to talk with other healthcare providers on how to manage various disease states from head to toe. How do you do that in a pharmacoeconomic way without breaking the healthcare budget and also without compromising health outcomes for patients? So I just took that same skill set, turned it on to sickle cell disease, and I also help educate other healthcare professionals, whether it be providers, nurses, social workers, nursing students, you name it, anyone that may come into contact with a sickle cell patient. That is who I have performed education for as it relates to sickle cell disease. So, in a nutshell, because of my own personal experiences in life and how God just threw me a curveball, and I just decided to play with it. And that is how Breaking the Sickle Cell Cycle was formed.
Absolutely. That's great. And talk about some of the work that you're doing on college campuses to educate college students as well as faculty and staff.
So most recently, we started a initiative with TSU and working with the students there and offering sickle cell trait testing. So we partnered with them on a weekly event that they have on campus where the students can come by and get trait tested. And then they also have in the spring, I want to say, and maybe fall health fairs that we are on campus having an initiative to raise awareness for students to get sickle cell trait tested. We also have started a collaboration with 23andMe, where we are able to offer free sickle cell trait testing through the Sickle Cell Carrier Awareness Program. But also through that program, we're able to offer people a way to do genetic testing to test not only for sickle cell trait, but for many of the other genes for common conditions like diabetes, high cholesterol, prostate cancer, breast cancer, some of the most common conditions that impact minority populations. Sometimes a person can be predisposed to those things just based on their genetic makeup. Well, if you had that information on the forefront, you could use that information to make lifestyle changes so that 20 years down the line, those conditions will not manifest in your life. Oftentimes when we find out about information about what's going on with our health, it's after the fact. It's after we have already been diagnosed. And by then it's probably, it's far gone. It's usually not in its early stages. But if you had some information, like you had a little crystal ball and you could look at it and see your genetic makeup, these are some things that you need to do today to prevent you from having these things in the future. I think that is well worth it. And then additionally, with our partnership with 23andMe, it also provides you with information on your ancestry. People oftentimes want to know where in the world are my people from. And through this testing, it can give you that information as well. So the Sickle Cell Carrier Awareness Program that we started with 23andMe, I want to say it was back in 2021 we started it. So we've been going strong now for a couple of years, and they have been great partners by way of offering us the ability to provide this testing to the community that we work with free of charge.
Yeah, it's excellent to hear that you have been, number one, getting partnerships and sponsorships from large organizations to be able to really push this mission, and that you're using your setback or your curveball that you were talking about to really empower other people and try to prevent other people from having to go through some of the suffering that you're going through. So that's excellent.
Right.
All right. So on Time Out with the Sports Doctor, this is your final timeout. So we've covered a lot of information in the last half hour, which I'm sure most listeners, if they don't have a PhD in sickle cell disease, learned something today from this. But if you could just kind of summarize the importance of early testing and knowing your status and why that's so important for your family and for others as well.
I would say knowing your sickle cell trait status, learn that early on. It's better to know the information ahead of time, and you don't even need it today, but one day you will. And if you participate in sports, I cannot stress this point enough. Even if you don't tell anybody what your status is because you think that it may hinder your ability to do X, Y, or Z in the future, that is not information that is meant to be disclosed to the world. That is your public health information that allows you to make informed healthcare decisions about your own body. That means when you are conditioning, when you are participating in sports, you know when your body feels different from the norm. You know if you have sickle cell trait that, hey, you need to stop, you need to rehydrate, you need to reoxygenate, because you can potentially die from what's called exertional sickling if you don't pay attention to your body. And it's not that hard. All I said was take a break and drink some water. It's not that difficult. But if you don't listen to your body and you continue to push beyond that maximum capacity, you could definitely be doing yourself a huge detriment. So I would say that, for first and foremost, one of the most important reasons why you need to know what your sickle cell trait status is, because that is a very, very easily preventable death just by drinking water, rehydrating, and
Right. And
taking breaks.
this is very important for anyone dealing with sports medicine, athletic trainers, physical therapists, team physicians, coaches, and other players as well. So please do not hide that information. If you're playing college sports, you're going to be screened, but high school sports, little league sports, probably not so much.
Right. And the other thing I wanted to talk about, though, for students who travel, altitude.
Right.
Altitude plays a huge role because decreases in oxygen are what cause those cells to sickle. For a person who has sickle cell trait, you may not have as many sickle cells as a person who has sickle cell disease, but because you do have some sickle cell traits, they can still undergo that sickling process. They can still form the blockages in blood flow. They can still cause you some pain. So that's why it's so important to be cognizant of where you are playing your sports. What's the altitude that's there? Because you may need to take you some supplemental oxygen with you. That's just, being prepared. So it's not to say because you have sickle cell trait, you can't participate in sports. That's not what we're saying. We're saying that you can play sports. Just make sure you're taking the proper precautionary measures to make sure that you can play those sports safely.
That's another great point. And I'd also, when you mentioned sports, I'd like to give a special shout out to Coach Tony from the Pull Up Podcast,
Yeah.
aka my fake uncle, for connecting us so we could be able to have this meaningful discussion. So thank you, Tony. And if you could just tell everyone where they can follow you, where they can get more information, your website, I put it up several times. It's a great wealth of information, but tell them where else they can find about your foundation and how they can contribute.
You can find us on all the social media, Facebook, LinkedIn, Twitter. It's at BRKBTHESS Cycle. So at BRKBTHESS Cycle on all social media channels. And then, of course, our website is there listed. And also, if you're interested in partnering with us, we're always looking for partners of all sorts, all kinds. And in September, which is Sickle Cell Awareness Month, we're actually having a 5K. So if you're close to the Nashville area or you feel like you just want to come on in and join us, we're having our 4th annual Sickle Cell 5K on September the 7th at Shelby Park. And we would love to have support from all around. So if you've got family here or you just so happen to be visiting, we'd love to have you come out and join us.
Absolutely. So we'll have all that information in show notes, and definitely come September, we'll be glad to promote the 5K as well. So
thank you
for absolutely. And thank you for your time. Thank you for just the wealth of knowledge that you share with the podcast today.
Hey, it's my pleasure.
Absolutely. Thank you for continuing to support this podcast. If you enjoyed this episode, then please leave a 5-star review. And if you haven't done so, subscribe so you continue to get the updated episodes. Until later, peace.
Hey, time out with the sports doctor. Keep our head right in the game. We ain't never stopping. You are now tuned in. Trust you don't want to miss. This is where life, sports, and medicine